implementation sites. So our plan with the community level is to have all of our implementation sites have a community level project by 2022. So that is kind of our newest addition to our prevention lineup here. And we started that this year, which is really exciting. And so I'm sure, you know, Steve might have me back to talk about how those things are progressing as we're moving forward. But today I'll be talking with you all about all of these strategies and what our educators are doing in your local schools and communities in your area to help prevent violence. So starting off with Green Dot, because as I said, Green Dot is the original Kentucky prevention program. So this started in 2010. So we've been doing Green Dot for a decade now, which is pretty awesome. So the purpose of Green Dot is to teach students skills of how to intervene in potentially dangerous situations. So how to be active bystanders and how to impact social norms in their schools, in their schools or in their communities, depending on, you know, where we're implementing the program. So Green Dot has two main parts. There's an overview speech, which everyone gets, and it's kind of the quick and dirty version of like how the overview of how do you do these different things, what are kind of green dots that you can do, how can you overcome your barriers, all of that good stuff. And then there's the bystander training, which is for folks who are identified as popular opinion leaders in their schools or communities. And so popular opinion leaders are people who hold social capital or have influence with their peers. And those folks go through a more intensive, usually 5 to 6 hour training that really digs deep into the skills building and practicing of like, how do you intervene? What are different ways that you can either directly intervene or distract the situation or get someone else involved? And like, what can you do leaving this training to make an impact in changing norms in your school or community? And so the reason that that training, the kind of time and resource intensive training, is targeted towards people who are considered popular opinion leaders is because it's kind of the best bang for your buck. So those are the folks in a certain population who are going to be the most effective at disseminating this new information. And so for us, we want them to be disseminating the idea that you should be doing green dots and everyone has a role to play in preventing violence in their school or community. And so these are the people that folks trust and listen to. And it's been borne out in the research that it's a really effective way of kind of, like I said, getting the best bang for your buck in terms of you don't have to train an entire school in this really time-intensive way, but if you are effectively selecting those folks who are going to disseminate the messaging really well, then you can still have similar impacts in the school, which is pretty cool. So that's kind of an overview of what Green Dot is and what we're teaching students and community members. So we have Green Dot in 49 high schools across Kentucky and 5 communities. So that's pretty awesome because we have expanded from 13 high schools in 2010 to now 49, which is pretty phenomenal. And we started out, you know, with no communities in 2010, and now we're up to 5. So I think this is a real testament to the awesome work that our prevention educators are doing at the local level. So I've told you a lot about kind of what Green Dot is. And so why do we do it? The reason why we do Green Dot is because we know it works, and it's an evidence-based program. Specifically, we know it works because we helped test it out. We were part of the Green Dot Research Control Trial along with the University of Kentucky and the CDC that proved effectiveness of Green Dot. So as I said, we started in 2010 with 13 implementation high schools. those schools were part of this research controlled trial. That was a 5-year study to see, does Green Dot work? So we had 13 implementation schools, 13 control schools, and did really intensive evaluation and surveying of every single student in all 26 of those schools to determine, is there a reduction in violence because of this program that we're doing? And so there are over 89,000 students who participated in the 5-year study. And the really awesome thing that came out of this, the reason that we're still doing Green Dot, is because this study showed a 21% reduction in sexual violence perpetration in schools where Green Dot happened compared to the control schools where it didn't. I just kind of want to give you all a minute to have that sink in of, there are 21% fewer people who experienced sexual violence in their formative high school years because of a program that we were doing. That's a really big deal. And that's why we're still doing Green Dot, because we are committed to seeing a world without sexual violence, seeing a world where that is not part of someone's formative high school years, where they can be safe and free and not have that experience. So that's why we're still doing it, because we know it works. There's also, we found a reduction in the prevalence of sexual harassment, stalking, and dating violence in Green Dot high schools. So we know it has impacts beyond just sexual violence to some of these other related issues. And so that's why we're doing it, because it's evidence-based and we know it works. A new kind of exciting thing that I have to share with you all is we have recent evaluation results that we just published. These came out last month. So this is results of our evaluation that we did from 2015, so right after the RCT ended, to 2019. So obviously this is a less intensive evaluation than a full RCT is, because that requires an extreme amount of time and financial capital and all of that to be able to do a full RCT study, but we still do vigorous evaluation of our programming. And so we were able to get some really great results. So the evaluation we do now is comparing folks who go through the 5-hour bystander training, so those popular opinion leaders, versus a control group of peers, similar peers in their school. And so between 2015 and 2019, we had over 3,000 students participate in our evaluation. And the thing that's really exciting for us is that we saw that for students who attended the 5-hour bystander training, their likelihood to do Green Dots, so to actually intervene in a potentially dangerous situation, increased, and their belief in harmful social norms decreased. So for students who attended the bystander training, they were more likely to talk to their peers about violence, call out inappropriate attitudes and language. If they hear someone bullying someone else, they're more likely to intervene if they see that happening, and they're more likely to take action as a bystander. So if they see something going on, they're more likely to either do something about it directly, to tell somebody else about it, get someone else involved, or to distract in that situation, which is what we want our folks to be doing. So that's really exciting. The other piece that was borne out in the evaluation is we see that acceptance of harmful rape myths and dating violence myths decreases with our students who attend the 5-hour bystander training. And so these are kind of, norms that have been borne out in lots of evaluation, that higher kind of belief in these myths leads to a higher likelihood of perpetration of sexual violence. And so as you decrease your acceptance of these myths, it's a decrease in likelihood of perpetration of sexual violence. So students who attend a bystander training are less likely to believe, that if a guy spends money on a date, the girl should have sex with him, or that some couples have to use violence to solve their problems. And what's really exciting for us as we're looking at this evaluation data is that we know, because of the evidence that we saw in the RCT trial, that an increase in students doing green dot, so an increase in them actually intervening in potentially dangerous situations, and a decrease in harmful norms, was correlated with the reduction in violence that we saw in the RCT. And so because of that, we can draw the conclusion that our programming that we're doing is still working, because we know that these two really big indicators of likelihood to intervene in situations and acceptance of norms, of harmful norms, because we're tracking change in those, we can extrapolate from that there is a reduction in violence based on the information that we have gathered through that 5-year RCT. So the exciting piece of that is, we know what we're doing is still working, which is really great. So I see some chats coming up. I want to make sure that I'm getting people's questions. So let me see what those are. It's hard to have these panels up while I'm going. All right. So Q&A question. So clarifying. Yes. So clarifying about the 5-hour training. So with the 5-hour training in schools, all students in a school will receive the overview speech, which is the shorter component, so that everyone in the school knows what green dot is. And then the 5-hour bystander training is for those students who are identified popular opinion leaders in the school. So that is kind of the difference, the two components with green dot. So thank you for asking me to clarify that. So it will be, our target for students who participate in the 5-hour training is to have 15% of a student population be bystander trained, because based on the theory of diffusion of social innovation, which is another fun public health kind of thing, 15% is really the sweet spot of where you hit a critical mass of people who are really effective at disseminating information to their peers. That's kind of the best bang for your buck in terms of that really intensive training. So thank you for clarifying that question. All right, so Green Dot, as I said, is kind of our original program, but we have started to expand out a little bit. And so we have now our middle school prevention program as well. And so as I kind of shared at the beginning, the middle school prevention program really came from feedback that we received from our Green Dot High School students. And so when they were telling us, we love Green Dot, think it's great, but we really wish we had something earlier on because we were experiencing violence earlier, we were like, all right, we need to do something about this. And so we need to figure out what's a middle school program that we can be implementing to help keep students safe earlier on in their lives. So our middle school prevention program is based on shifting boundaries, and we've adapted it to be more relevant for Kentucky middle schools. So the reason we selected shifting boundaries as the basis for our middle school prevention program is because it does a phenomenal job of explaining boundaries in an age-appropriate way. And so we thought that the curricular content was super great and was going to be really useful for our students in our Kentucky middle schools. It also has a community level prevention component baked in, which I'll talk about in a little bit, but that was exciting for us as well to kind of expand our programming beyond the individual and relationship level that we'd been doing with Green Dot for quite a while. But we felt that there is a need to adapt the program for our Kentucky middle schools. One, because shifting boundaries was piloted in New York City schools, and as you all know, New York City is very different from Kentucky. And so some of the examples and scenarios and ways that they said things just weren't relevant for our students. And we knew that if we tried to, show some of those videos, they would be like, this doesn't apply to me because, I don't live in New York City. So we had to make some adaptations there, and also to make it kind of fit the way that our middle schools are structured. It's a little bit different, it seems, than what they are in New York City. So we had to make some adaptations there. So our middle school prevention program has 4 classroom sessions for each grade. So it's for 6th, 7th, and 8th grade. And so it has the classroom sessions that build skills and knowledge. And then there's the school-wide environmental intervention. So they're kind of like 2 components, similar to how with Green Dot, there are 2 components. Our middle school prevention program has 2 components as well. So in those classroom sessions, the main learning objectives are really to help students define the meaning of boundaries and the role of boundaries and their friendships and their dating and romantic relationships, to help them communicate their boundaries and recognize other people's boundaries, and then to help students determine the elements of a healthy relationship. And so we think this program is really great because it's talking to students in a way that is relevant for them at that age, and it kind of builds upon itself over the 3 years. So with 6th graders, we're really just talking about how do you know what your own boundaries are and how do you see those boundaries in other people, kind of keeping it at that age appropriate level. In 7th grade, we build on and talk a little bit more about what do boundaries look like in friendships? What do they look like in romantic relationships? And then in 8th grade, we build on even more to talk about what are components of healthy relationships? What does an unhealthy relationship look like? What can you do to support a friend if they are in an unhealthy relationship? So the 3 grades build upon each other. And we also think it creates a really solid foundation for students who might be in a middle school that will then transition into a Green Dot high school. They'll be set up to understand Green Dot content even more because they have this foundation of understanding of what boundaries are. And when boundary violations happen, that's a place where you need to intervene. So then when they go to high school and get Green Dot, they're learning, okay, how do I intervene in those situations? So that's what the classroom sessions are. And then, as I said, there's also the school-wide environmental intervention, which is hotspot mapping. And so through school hotspot mapping, students identify where in their schools are safe and unsafe spaces. And then we work with like school administrators and teachers and staff to figure out how can we make changes to the school environment to make those spaces safer. And as I said, hotspot mapping is a community level prevention strategy. So I'll be talking more about that a little bit later in that section. So we started our middle school prevention program in 2018. And since then, we have expanded to 15 middle schools, which has been really exciting to see. We started with 5, I think it was, in 2018. And so now we're in 15. And I'm excited to see how this continues to grow across the state because we think this is a really great program. So similar to Green Dot, we do this program because we know it's effective. And that's really based on the RCT data from the Shifting Boundaries study that those really great researchers and evaluators did in New York City. So in that study, there were over 2,000 students that participated, and kind of the awesome things that they found are there is a 50% reduction in victimization and perpetration of physical and sexual dating violence in schools where they implemented the Shifting Boundaries program up to 6 months after the intervention. So that's huge. That's a really big reduction. They also found that there is a 32 to 47% reduction in peer sexual violence victimization and perpetration up to 6 months after the intervention. And so that's some really phenomenal research data. And that's kind of the basis of how we know that there is research backing up our middle school program because it is very solidly based in Shifting Boundaries. But we're still very much in the early stages of data collection for our Kentucky specific adaptation. As I said, we started implementation in 2018, so we're only in year 2 of data collection right now. But we're very excited to see, from our evaluation, how that data is going to bear out. I know anecdotally, we've seen it's made a really big difference and our students like it a lot. And so we're excited to see data-wise, what is that going to look like in our state specifically. Let's see. So I have a few questions here that I'll go ahead and answer. So question is, do they have Green Dot training in Madison County schools? I don't think so, but I'll have to double check on that. And then the second question is, what was used to determine the schools that the program would be implemented in? So that's a really great question. So we have our local centers who are doing implementation of the programming. And so it really depends on which schools are willing to let us in to do the programming. That tends to be the biggest indicator of where we are and what schools we're in. So that's pretty much it. We reach out to schools that are that we think could benefit from the program. We think all schools could benefit from the program because it's keeping students safe, and that's helpful for everyone. But some schools are more or less willing to let us have kind of the time that we need to do a really effective implementation of the programming. And so that's usually the biggest barrier we face, is if schools are willing to work with us on that. So let's see. The other question I have is, who teaches the Green Dot program in each school? Yes, so we have prevention educators who are employed at the local rape crisis center, who are, very well trained and have a lot of experience implementing this programming. So yes, in the Bluegrass region, Ampersand Sexual Violence and Resource Center has a prevention educator that implements the programming there. We also like to work with schools to have some of their teachers or staff trained in the programming as well to assist us in implementation, because that helps us with capacity. A lot of our centers only have one educator, and so it's hard for them to do programming in lots and lots of schools. And also, it's good to have, that sort of buy-in from teachers and from staff to be there and be part of the program. So in some of our schools, there are teachers and staff who are trained, but for the most part, it's prevention educators from the local rape crisis centers who are leading these programs. So thank you all for those questions. All right. So moving next to community level prevention. So unlike Green Dot and unlike our middle school prevention program, community level prevention isn't so much like a program with a set curriculum that you follow. It's more of a concept. As I kind of mentioned before, it's related to the social ecological model. And so it's the third level in that model. The individual level, relationship level, community level, and society level are the four. And so community level prevention, it's targeted towards mitigating risk factors or bolstering protective factors to stop violence before it starts, what prevention is, by impacting the environment of a place. So that could either be the physical environment, like things that you see and touch, or it could be the social environment. So how you feel in a space, what the norms are in a space, that sort of thing. So this is our kind of most recent shift in prevention programming, is moving more into the community level. And there are a few reasons for this. One, the CDC is really supporting a movement across the US to increase the work that we're doing at the community level, because for a long time, many places have just been doing individual and relationship level work, which is great. You can have really effective prevention at the individual and relationship level, which we would do with Green Dot, because Green Dot, as you saw, has that really major reduction in incidents of violence, and it's at the individual and relationship level. But the CDC is pushing this movement of sexual violence prevention to expand beyond kind of our comfort zone and move into the community level. And the reason they're doing that is because we know kind of through our public health theories that prevention is more effective when you're hitting multiple levels of the social ecological model. So if you're teaching people skills, if you are improving how their relationships are going, and you're making their environment safer, that is going to be much more effective at preventing violence overall than if you were doing just one or two of those levels. Also, community level prevention reaches a lot more people than traditional individual or relationship level programs are, because you don't have to, have students come and sit in a classroom and you teach them things. You can be doing things that are changing the environment in which they are engaging with their friends and making decisions and all of that kind of stuff, like the environment around them. You can make changes to that to make it safer. And so you're protecting kind of, I think of it as like a protective blanket going over, a whole school or a whole community. It can be a much broader reach than if you have to individually target someone to teach them a new skill. The last reason that we're really excited about community level prevention is that it has a lot of shared risk and protective factors across multiple kind of public health issues. So some of the big ones are shared risk and protective factors with interpersonal violence, suicide, and substance use. So if you think of some of like the risk factors or protective factors for all of those public health issues, at the community level that can connect with sexual violence. So access to like high density of alcohol outlets in a given community, that's a risk factor. That is part of the environment for sexual violence. And it's also a risk factor for IPV, suicide, and substance use. Similarly, community connectedness is a protective factor across all of those public health issues. And so by working on community level prevention, specifically for sexual violence, that's what we're focused on, we're also going to be making an impact for all of these other public health issues, which is pretty cool. So our plan, as I said, this is kind of our newest addition to our prevention strategies that we've got going on. So we started this year implementing community level prevention, and I'm very excited to see how it goes in our local schools and communities. And in terms of implementation, it's our goal to have community level prevention happening in all of our implementation sites. So all of our middle schools, high schools, and communities by 2022. So we've got 2 years to make a really, big impact. And for community level prevention, there are kind of 3 main identified community level strategies that have evidence to back them up as effective. And so these are the 3 that we are focusing on in Kentucky right now. So they are hotspot mapping, policy change, and social norms change. So I'm going to dive a little bit more into all 3 of these now. So hotspot mapping is identifying areas of a place where people there feel safe and unsafe. So this is actually an example from one of our middle school prevention program schools, where in that program, we give students a map of their school and have them color red, yellow, and green for where they feel unsafe, kind of in between, and safe. And so we get these maps from oftentimes hundreds of students, and we take all of that data, put it all into an Excel spreadsheet to analyze it, to figure out, where are the places in the school where students feel really safe, and we can kind of try and replicate those things and congratulate the school for doing that good work. And where are the places in the school where students feel unsafe, and what can we do to change the physical environment of those spaces to make it safer for students? So if it's, potentially the end of a really dark hallway where students feel unsafe, maybe we would put in additional lighting there to make it brighter and increase visibility. Or maybe it's a stairwell where there's a lot of like chaos and there's kind of a tendency for students to get pushed and shoved and all of that kind of stuff in their stairwell. Well, maybe we'd make that a one directional stairwell so that the flow of traffic goes a lot smoother and there isn't as much opportunity for that kind of bullying or physical violence to take place. So that's the goal of hotspot mapping. Right now, we're actually working on developing a virtual hotspot mapping platform, which we're pretty excited about. So because of COVID, with a lot of our schools, we can't be in person with students, but we don't want to let that stop us from doing our programming. So we're working to create kind of like a virtual coloring book platform where students will be able to still engage in the hotspot mapping like activity, even if we're not physically with them. So we're pretty excited about that and are hoping that it will be ready for implementation next semester. So send good vibes our way for that to happen on schedule. So this is one of our community level prevention strategies. The next one is policy change. And so policies are, kind of defined as binding, enforceable written statements that reflect the values and decisions of a group or organization. And so policies really reflect what organizations care about, and they guide what is deemed acceptable behavior in a school or workplace or state or nation. We have policy at all of those levels. And so the reason that policy changes a community level prevention strategy is that by changing the policies of, let's say, a school, you are reflecting what that school values, you are setting norms around what is acceptable behavior in that school. And so because of that, you are changing the way that the social climate of the school works. You're changing the environment in that school, hopefully to not tolerate violence and to support survivors of any sort of violence. So some examples of policy change kind of initiatives that have been proven to work at reducing instances of violence. Those would be strong workplace or school anti-harassment policies. So having it be very clear what the policy is for the school, you have to then publicize it. So make sure that the population knows what the policy is, and then you have to actually follow up and do it. So it's more than just putting a policy in place. There has to be the follow through so that people know that, oh, this is actually a thing that people are taking seriously. So this is, what's deemed acceptable behavior in the school or unacceptable behavior, and we need to follow this and not, harass people at school. This can also apply to anti-bullying policies. So one of our rape crisis centers is actually implementing this at kind of a school district level. They're working with a group of students in their school district to change that district's policy to have a stronger anti-bullying policy. And for the same reasons, it signals, what are the norms in the school district, what is considered acceptable behavior, and following through, we're not going to tolerate bullying, and that's not okay here. So I'm excited to see how that project goes. We also have policies that are active bystander policies. So in some of our Green Dot schools, we're telling students like, be an active bystander, intervene when you see something potentially dangerous happening. But you also have the school at the same time saying, if you intervene in certain situations, even if you are being an active bystander, you'll get in trouble, just like the people, if it's a fight, the people who are fighting will get in trouble too. And we found that that is actually a really big barrier for students to intervening because they feel like their schools aren't going to support them if they do actively intervene in a situation. And so we have another rape crisis center who's working on that policy in one of their schools, is figuring out how can we add in some nuance to our policies so that we're supporting our students who want to be active bystanders and signaling that that's something that the school actually really cares about. So those are kind of like organizational or school-based policies that can work to change the environment of those places. The last example that I have for you all is kind of more, it would happen at like the local government level, but I think it's pretty interesting. There's a lot of research showing that having a high density of alcohol outlets, so places that sell alcoholic beverages, like liquor stores or bars and things like that, having more of those in a certain geographic area is a risk factor for sexual violence and many other public health issues. So some policies that have been really effective are kind of local ordinances saying you can only have so many of those alcohol outlets in a certain geographic area. So reducing the density of those has been proven to reduce incidences of violence. So there's kind of a whole array of different policies that can be introduced at a lot of different levels to help prevent sexual violence. So the last community level prevention, evidence-based strategy that I have to share with you all is social norms change. And so the social norms approach is really geared towards motivating individuals to adopt social norms that will create positive health and well-being. And so for us, it's having people adopt social norms that are intolerant of sexual violence, that promote healthy relationships, that promote it being a norm for people to intervene in potentially dangerous situations. And we know that, for students and for, all of us, honestly, the way we react to violence is often either based on or influenced by what we see other people doing or how we think other people would act in that situation. So it's based on what we perceive norms to be, what we think is normal or okay or appropriate. And so if we can change what those norms are to promote safety, that can have a really big impact on preventing violence in our schools and communities. So there are a few ways that this can happen. One is by correcting misperceptions about social norms that lead to harmful attitudes. Another is changing or modifying negative or harmful social norms. And the last is promoting positive social norms. And so all of these are effective strategies, but what the literature really bears out is that correcting misperceptions is kind of the most effective of the three. And so that's the one that we are focusing on for folks in Kentucky who are doing social norms change projects. We're focusing on the correcting misperceptions one. So these are two examples of correcting misperceptions campaigns. They didn't happen in Kentucky, but they're pretty cool. So the first one says 98% of U of A students stop the first time their partner says no. The second one says 4 out of 5 Gateway guys really don't want to hear trash talk about girls. And so the thing that's interesting about these is like the way that you do a project to correct misperceptions is first you have to determine what are actual norms and what are perceived norms. So for the stopping the first time the partner says no, you would ask students a question of, do you stop the first time your partner says no, and see what they say? And then you also want to ask them, do you think your peers would stop the first time your partner says no? And if there's a discrepancy between those two, if most people say they would stop, but they think that maybe only half of their peers would do so, there's a misperception in what the actual norm is, so what people are actually doing, and what they think the norm is. And because norms are a lot of what we think other people think about certain situations, if we're able to say, no, actually, most people are doing this healthy behavior, it's very effective at changing the way people perceive those norms to be. So we're not forcing someone to believe something completely new. We're just taking away kind of the misunderstanding or the social pressure of acting upon what they already believe. If you think you're the only one who believes something, it's going to make it a lot harder to act on it. But if actually everyone is believing that thing, and you know that, then you're more likely to act upon that thing that you already believe. And so we have a few folks across the state who are working on this type of project in their schools and communities. And I think it's going to be pretty exciting to see, how all of these new initiatives that we have going on at the community level are going to bear out. So I just told you about a lot of the awesome work that our prevention educators are doing. And so I would be remiss if I did not take the time to also use this platform I have to encourage you to do something yourself about preventing sexual violence. Because the fact of the matter is, we all have a role to play in preventing sexual violence if we're really going to bring about a world free from violence, which is what we're trying to do here. And the great thing is, there are a lot of things that you can do. And so I hope that you consider some of these options and think about what might be realistic for you and your life. The first one is supporting your local sexual violence prevention program, so your local rape crisis center. Our rape crisis centers do phenomenal work. What I talked with you all about today is just a fraction of the work that they do with prevention. They also do advocacy and support services. It's pretty amazing. And so they can always use more support, either through financial resources, through providing time and volunteer hours, or social capital. I know when I was answering a question earlier about how do we pick which schools we go into, I said, sometimes it's dependent upon whether or not schools will let us in. That's a big factor. And so, if you have relationships with people in local schools or the school board or something like that, that's kind of what I mean by using your social capital, is helping out your local rape crisis center to make that connection for them between the schools and the program to help facilitate that process, because that oftentimes can be a big barrier for us to getting our programming to the students who could really use it. The other thing you could do is do something in your work. So I know a lot of folks on here are probably from other prevention-focused public health fields. And so, as I talked about before, there are a lot of shared risk and protective factors that we can be addressing between sexual violence and other public health issues. And so I would really encourage you, if that's something that you have the opportunity to do, is address some of those shared risk and protective factors in your work. So thinking about, what are the ways that the things that you're already doing could relate to sexual violence prevention, because I think the more that we make those connections between our public health fields, the more effective we're going to be overall at stopping a lot of these public health issues that we're all trying to work on. And then lastly, is do something in your personal life. So being an active bystander, doing something when you see something that, doesn't sit quite right. It doesn't have to be directly intervening, though it can. It could be getting someone else to help you out or distracting the situation entirely. But doing something can go a really long way. And lastly, showing that this issue is important to you, having conversations with family members about, why you think violence prevention is important or what they can do to intervene in situations, talking with your coworkers about it. There's a lot that you can do to show that sexual violence prevention is important, and starting to set that norm that we all have a role to play in this work. So I very much encourage you to kind of think about, what is it that you can do? What is one thing that you can do to make a difference in this work? Because if we all do our one thing, that's when we're really going to see some change. So thank you all so much for listening to me today. I love talking about the awesome work that our prevention educators are doing. And so it always makes me really excited to get to share with folks that. You can follow or get more information and follow KSAP on our different social medias. Our website has a lot of really good information. If you want to connect with your local center, you can find out what center is in your like county in your region at our website. We have an interactive map that you can do. If you have questions or something comes up after this presentation that you thought of, you can always email me. My email is there. And yeah, I just really appreciate you all being here for this presentation. So I see some questions popping up in the Q&A chat, so I will look at those. Boop, boop, boop. So I don't know. I think some of these are probably for you, Steve, of will the PowerPoints be available? I think so, but unsure.
Most certainly, they will be available with your permission.
Yep.
And I did start recording, if it's okay with you to share that. I did start a little late, so we're going to miss probably the first 3 or 4 minutes.
That's
But
okay.
it was a great presentation, and thank you so much for
Yeah.
this presentation.
Thank you for having me. This is a great time.
Will there be a certificate? No, there really won't be a certificate for this presentation. We will make the PowerPoints available. And I think that answers most of the questions we have. I would also like to invite people right after this session. We have a session coming up from the Kentucky Office of Highway Safety providing updates. And tomorrow at 9 a.m., we will have a presentation sponsored by KSPAN on suicide prevention updates from the Kentucky Department for Behavioral Health, Developmental, and Intellectual Disabilities. And you can register online. Go to our website, www.safekentucky.org, to register, and we welcome you to attend those as well. So, yeah, are there any other questions? We're about we've got a few minutes, but I do need to start the other presentation here in a few minutes. So I will send out the PowerPoint slides to everyone that registered, and then they will also be posted on our website. I think did I miss any questions? I don't think I have. Okay. I believe you're on mute. Okay, there you go.
Yeah, there's another question from Dominique. So how do you make sure people aren't responding to the surveys of like how we think they or how they think we want them to respond? That's a really great question. It's something we think about with our surveys, particularly with the social norms survey, because we are trying to like figure out what actual norms are versus perceived norms. And so figuring out there is a kind of like if I had our evaluator here, she'd be able to tell you the actual term for it, but it's like bias towards social desirability. And so wanting to answer the way that people, you think people want you to answer. And so we do a lot of really intensive like looking at our survey questions. So we have a contract evaluator who has her PhD in like this type of evaluation practice. And so figuring out with her, like, how do we ask questions in a way that's not leading people to answer in the way that we want them to? That's kind of a big thing that we try and do is just in the wording of the questions, being really thoughtful about that. But also, that's kind of something we have to take into our analysis is the fact that there is a bias towards social desirability. And so recognizing that that's often something you have to contend with. But that's a really good question, Dominique. So thank you for asking about that. Yeah. And then in terms of, are there CEUs from KSAP for SANE nurses for this information? Unfortunately not. There aren't CEUs for this presentation, but I appreciate if you are a SANE nurse, you doing that great work. So yeah, thank you all for having me today. Again, if you have follow-up questions or other things that come up, feel free to email me. And yeah, thanks, Steve.
Well, thank you. And we hope you'll join some of our other presentations, and we hope to have Ms. Howard back in the future to provide an update, because excellent presentation. Thank you. And with that, we'll close out the presentation and start our other presentation. So thank you all.